Usually people tell patients when they come, so we have to focus on prevention first.
Yes.
Right now for anything that could develop in certain amount of time. And then we should start working on the issues that you already have. But we have to go through history, of
Yes.
course, to see where the root cause potentially could be and then do the testings. I mean, of course, it is sometimes expensive because you have to dig deeper.
Yes.
And unfortunately, any kind of insurance doesn't cover those stuff. So, I mean, I will give my best to decrease the cost as we can. But sometimes, I mean, I know for my own health, I spend thousands of dollars just to do testings and then find out where is the issue. And when I found out, I basically, every other dollar that I have, I kept it in my pocket. So I'm not spending it anymore and just doing like regular blood checkups and anything.
Right.
Because HbA1c is one part, or insulin is one part, C-peptide is one part. But where is the stuff that are leading to that?
Yep.
So we have to check it. And that, I mean, that's time consuming, especially when you wait for results. When you're in Europe and you're sending it to US.
It's 3 weeks just for us. So for you guys,
a week,
I'm sure it's
2
much
more.
longer.
Yeah.
This is Doctor Talks.
Hi, I'm Dr. Ashley Beckman, and we're here with the Longevity Leaders podcast. And I am here with Dr. Omar Nuhic, who is from Bosnia, and you're an MD there. Correct?
Correct.
So tell us a little bit about your practice, first of all, and then we'll dive into how this is taking you into the longevity space too.
Thank you for having me today. So I'm MD from Bosnia, and we have a brick and mortar in Bosnia, and we are doing virtual practice as well. So we are functional medicine based practice. We do as well regenerative medicine there. So we are focusing on metabolic health or type 2 diabetes specifically, then as well insulin resistance is in that condition, and PCOS, so polycystic ovarian syndrome. So these are primary diseases for diagnosis, I can say, with whom we are working with. And I mean, we had really good results with people that are having type 2 diabetes specifically. They even, many of them get rid of drugs totally, or at least they reduced using of drugs. But I mean, the thing for regarding functional medicine is it's really amazing because you're going to the root cause of the disease.
Yes. So what have you been seeing as some of the main root causes in your clinic?
Yeah, it was really interesting regarding type 2 diabetes. I mean, that was a few years ago, 4 or 5 approximately. So when I had first patient with type 2 diabetes on functional medicine based practice, we did DNA testing, epigenetics, and I've seen that they don't have any kind of mutation on FTO gene or PPARG2 genes or TCF7L2. So those are basically genes for type 2 diabetes or for fat, basically developing obesity. And he didn't have any of those. He had only GSTM1 and GSTT1 null genotype. So he had deletion of these genes. And that was really interesting because that's when I saw that diabetes type 2 doesn't have almost any kind of connection with genetics. It can be, of course, but that's when I seen that that guy specifically, he had heavy metal toxicity and he had mold toxicity as well. So he had aluminum all over the head and he had ochratoxin A. It was really, really high. So when we started cleansing him, so because of course he had these mutations, so he couldn't do detox properly. So we did step by step. He was using 10 pills a day.
Oh, wow.
So different ones. He had hypertension, gout. So he had fatty liver, diabetes type 2, depression, hemochromatosis.
Oh, wow.
So he was like all over the place. Really, really big mess. And after 3 months, he stopped using everything.
Wow.
His labs were perfect. I was like, okay, how fast he got results. I mean, that was really fascinating. He did even a testimonial for us a few months ago. That was 3 years ago when we did all of the program and everything. So I was fascinated really how he responded. I mean, that's the thing where you can see that people change their lives and family, of course. Because right now his wife or significant other doesn't have to worry. Will he have crushing of sugar or too much high sugar? I mean, that was really eye-opening moment.
So he was open to changing his lifestyle.
Yeah, he did everything. I mean, he was entrepreneur, so he couldn't do stuff without his wife, of course. He was working like 18 hours a day, so sleeping these 6. And his wife basically was on meeting with him, consultations. So they decided she will cook because she was housewife. She will cook and he will handle everything else. So he was really like like in Navy. So he was following everything.
Oh, yes.
And I mean, that's why he got results really quickly. So he changed food and everything.
And I think that's the thing that's amazing to see is people think some of these things, which they do take a long time, like for mold detox and metals, but the blood sugar, you can regulate that fairly quickly when you make a lot of the correct changes.
I agree. Food plays a really crucial role because if we see how we are eating today, it's SAD systems, standard American diet. I call it as well SBD, standard Bosnian diet. It's
I was
pretty much
what's
same.
for there? Is it
SBD.
Oh, no.
So there's no much different really. Because it's based on carbohydrates all the time. You have some meat, but that's grilled one, so you don't eat that much beneficial fats. So yeah, unfortunately, that's lifestyle. I mean, we have to change our lifestyle if we want to get rid of the blood sugar spikes. So yeah, he did that, and as many others. So, and that's the moment when we saw falling down of the blood sugar.
Yeah,
few of them stopped using even insulin injections. So yeah, that was really, really amazing stuff.
Yeah, it is really amazing. And it usually does take a family or a team effort, right? Because it's difficult when someone or only one person is choosing to make the changes. And, then they still have treats around the house or things like that. So it's really important to get the whole family on board.
I agree. If you don't have support, that's really hard to do. For example, I have advised them, so move anything that's processed or that's non-organic from your house.
Yes.
Because otherwise he will fail at some time.
Yeah.
That's not, if you're having sweets on your table every day and you're looking at it and that right now you are having blood sugar spikes and lows, so highs and lows, so you'll have an issue, definitely. I mean, you couldn't handle it anymore. Like after 7 days, you'll reach take one. So yeah, they did every correction that I said they did. So they got really good results. I mean, beside him, there are a few more like specific stuff. What was going on? So one guy, he was doing night shifts for a certain time.
Yeah.
He developed type 2 diabetes, and he was just on metformin, using it, and it was pretty much stable, if I can say so. The most spikes were up to 300. So I mean, that's high, but still. Then COVID happened. So he was 3 months off.
Oh, right.
And then we started working. So we get rid of even metformin in like month or so.
Yeah.
But since he started again do night shifts, his blood sugar again went up and you couldn't do anything. So that's the point when I told him, okay, if you're going to do night shifts, we are much limited what we can do there. We can support you, of course.
Right.
We could handle other stuff, but we cannot go, at any point like you were before.
Right.
Your body can't handle it. It cannot regenerate itself. You have to give him sleep. You have to give melatonin enough, growth hormone enough so to regenerate and everything. So yeah, that was eye-opening as one moment. So how much sleep plays a role in blood sugar.
And that circadian rhythm, right? When you're going against nature.
Yeah.
It is a lot more challenging for the body to, it will react much more.
If you're a medical doctor, nurse practitioner, chiropractor, or other health expert that's stuck in a broken system, there's a better way. The Freedom Webinar shows you a proven 5-step system to build a 7-figure virtual health practice, or how to modernize your current brick and mortar practice without the burnout. Learn to create high-ticket programs, automated income, residual revenue, and attract clients ready to work with you. Book your $1 million strategy session today by clicking the link in the description.
I agree, because longevity concept, usually we are going, of course, all the time to research new stuff. We are going to introduce it, but we have to focus on basics.
Yes.
If you don't have enough sleep, there is no supplement that will help you with that.
No.
If you're not eating correctly, there is no supplement that will change those stuff. So we have to get to the root stuff.
Yes.
And then change and add supplements and all of these other techniques.
So then you're able to do the like urine mycotoxin testing, to use Vibrant?
Yeah,
or
we use, basically, there is DNA Life or Nordic Labs. That's how they are calling them. Basically, they are distributors from US labs here. Yeah. So in Bosnia, specifically, we use mycotox profile from their Mosaic Diagnostics. So from them, you use that. We use heavy metal from Doctor's Data. And all this, we do provocative testing a lot. We do GI 360 from Doctor's Data as well. DNA testing from Nordic. They have their own DNA testings. So yeah, those are the four main ones. They're as well testing for toxins like glyphosates and all of those stuff. So we do that as well. Neurotransmitters we do from Dr. Zeta as well. So Vibrant is not that much present in Europe, unfortunately, but they are really amazing lab. So I would wish to have them here. I mean, in Bosnia, but in USA, I'm doing all over Rupa Health. So because you could easily manage the stuff.
Yes. So then are you seeing a lot of glyphosate that's high?
Almost in every patient that I see. So and really, really high. So that's not like small value. They're really high because they're all of the food. When patients usually come, they are already in high inflammatory state. So even though they are using some of them are using or trying to use organic food, but that's contamination from years ago.
Oh,
so
yes,
you have to clean those stuff.
Yep. And you're seeing a lot of metals as well?
Yeah. So we did one research. I'm planning to publish it on our clients or patients specifically. So it was shown like 84% had aluminum really high of the patients. 75 had two metals, aluminum and some other. And 65, they have three metals. When we do provocative tests, of course. Lead was really present as well. High values. Uranium.
Yes.
Really high. And mercury from time to time, depending on amalgam fillings and if they eat fish or not. Usually. Yeah. So mycotoxins, that was really one of the eye-opening moments. So 91.8% of patients had at least one mycotoxin present.
Yep.
And around 87, I think, percent had two. So that was really, really.
Yeah. In my practice, I don't remember the exact markers, but it was 95% of all my clients have, I'd say, three or more. And now I'm seeing that where I used to think, 6 to 8 markers was high. Now I'm seeing multiple clients with 10 types of mycotoxins. And it's a really big issue.
I agree. I mean, unfortunately, before when I started to do functional medicine, this was the moment that I oversaw those stuff. Because since I started functional medicine and I had my own health issues, that was my eye-opening moment. So, because I had more toxicity from our childhood.
Yes.
So we were in war during 90s. So afterwards, the houses and everything were pretty much destroyed, and then you're building it from scratch. So I had mold toxicity, I had strep infection, I had dairy reaction, I had MCM6 gene mutation. So we had that, there were like chaos in my body. So that was what led me to functional medicine generally. And then I had insulin resistance as well. So that was my eye-opening moment for opening doors for metabolic health signature program that we are doing right now.
How did you get into want to be an MD? Before you got to functional medicine?
That's a really good question. So my grandma, I was really connected to her when I was in high school, so fourth grade, so end year. So she was really sick. She got colorectal carcinoma. So it was already metastasized, and they did operation surgery. Basically, they removed some stuff, but she was like in half comatose state, and physicians were really bad acting to her in Bosnia specifically. So that was my moment when I decided, okay, I will go into medicine just to not be like that. So at that point, I wasn't looking at any other stuff.
Right.
But I was really, really connected to her. And when I saw those things, I said, okay, I'll pass the exams, everything, but I'll at least try to be human.
Right.
At least that's most important stuff. We can do whatever we wish, but you have to be human all the time, and you should put yourself in shoes of another person when you see them at the practice.
Yes.
So, I got goosebumps when I mentioned those stuff, because really it was hard time at that part. They gave me their own apartment, so I would sell it to go to medicine, to medical school, because I didn't have money at that time. So yeah, in Bosnia it's different stuff than it's in USA, because you have scholarships and everything. In Bosnia you don't have that many, so it's pretty much hard to do those stuff. And then when I was like sixth grade or year at medical school, I had developed really serious issues with my own health, and then I started to research. I was using a lot of antibiotics, like 4 times a year. I was on like 2-3 different antibiotics.
Oh, wow.
1 month I'm drinking antibiotics. So my gut was horrible.
Yes.
I was like bloated all the time, constipated, had pain, vomiting even from time to time. My blood sugar was up and down. I had headaches every day. I was using aspirin or salicylic acid.
Yes.
So yeah, I was in chaos really. And then I started to research, and then that's the moment when I found Dr. X and his website and everything. So I found another way. That's the moment when I found out about functional medicine. Then I signed up for it, and then my journey started later on.
And how long ago was that?
It was like 7-8 years ago, approximately. So 2018.
So how have your clients been open to functional medicine? Like it seems unique, right? Where you are? Or is it really getting more popular?
Yeah, it's really good question. Right now it's getting more popular. But when I started to do that, everyone was asking me, okay, what are you doing? What the hell is functional medicine right now? And I mean, the thing is, when you're starting functional medicine, so we usually patient bring you all the reports that they have from previous years and whole history. And then you have to sit down, you have to go through the reports and make some notes, and then make whole plan, strategy to treating them according to that. And at the beginning, it was really hard because you have to catch all these details.
Yes.
But right now, it's not that much hard because you have experience, you have everything, you have more knowledge than at that point of time. And I mean, right now, they're pretty much open. I mean, there's a lot of TVs in Bosnia specifically, and in Balkans, Southern Eastern Europe, where I was as a guest speaker. So I gave a lot of lectures in Europe all over it. So yeah, right now it's pretty much popular. People are seeing it, especially regarding the lab testing and everything. I think that US played a really crucial role regarding opening the doors for functional medicine, even though I'm the only one. So they're, yeah. But I mean, still, Bosnians are usually speaking English really good. So they don't have the issue with listening podcast or something else.
Right, yeah.
So yeah, for example, they heard a lot about Dr. Isaac, Dr. Hyman, and X as well. So those are the three ones that usually they listen to. So yeah, that was the door opening moment.
And you're implementing some longevity now too. Is that right?
We are starting to, from the 1st of January, we are right now preparing the signature program regarding longevity stuff. So we'll do it as a 6-month program. So where we'll introduce all of these things that we were researching through all these years. And I mean, the basic stuff that I've seen, for example, in this patient that I mentioned before, like he was using 10 pills and everything, we did true age testing on him. So it was really interesting. Wherever he had toxicity or issues with, so their ages were pretty much higher than he was chronologically.
Yes.
So that was the eye-opening moment as well. So I've seen that if you want to solve issues or you want to have longevity concept, you have to work on all of these previous stuff, toxicities, gut health, so all of these things. Yeah, so I'm really looking forward to that.
I know it's fun. I love toxins, of course. As mold got me into this arena a little bit deeper. And again, it's those things, right, of when you know, however it manifests for you, it'll go to a weak system. But you can't hop right into longevity without 100%. Cleaning up things first.
100%.
And those true age and true diagnostic tests will show you some weak areas or areas for improvement.
Yeah, where are you at?
Yes.
Yeah. I mean, amazing stuff. There's one more thing what I've seen connection really with longevity as well. Lyme disease.
Yes.
Yep. So I wasn't aware how many people have Lyme.
Yep.
I mean, like 80% approximately from our patients at last year that we tested.
In Bosnia?
In Bosnia, yeah. I mean, although even some of them come from Germany or Austria, they come on brick and mortar practice, but still 80% of them, when we do protein sequencing, immunoblood testing, and then you do immunodeficiency CD57 and all these testings, you can see them that they're positive. And no one ever treated them because they didn't have that bullseye.
The bullseye, right?
Yeah. Yep. So that was horrible experience at the beginning because I was like, okay, it should be some symptoms, but usually what they had is chronic fatigue syndrome
and joint pain and migraines.
Right. Yeah. Like fibromyalgia.
Yes. Yep. Yeah. And that's, again, that was part of my journey. And so you just, you keep learning and diving in and learning more because a lot of the things that we were taught, and especially even, I'm sure for you through traditional medical school, you're not taught to put these things together at all.
Not at all. I mean, you're just used to, like, if you have bullseye, give antibiotics and that's it.
And you're good.
Yeah. you should be good.
2 weeks.
And then afterwards, if you have some issues, go to psychiatrist or psychologist.
Right. There's something wrong with you mentally.
In your head, yeah. So you have to fix those stuff. But I mean, this is really, I mean, I enjoy helping people really. Because when you see someone that gets rid of the disease or symptoms that he has or she has, I mean, my heart is full really. For example, this guy, I mean, I give definitely this time, I give him a hello and then everything. I want to thank him for everything that he did all over these years. And I mean, if one gives me even like, I don't know how much of money, when you see the one the one specifically that he solved his issues,
right?
You cannot pay those stuff. Your heart is fulfilled.
No, and especially getting them off 10 different types of medications. And people, again, they're usually just in that routine of thinking that this is the way their life is going to be. But they do have to have the motivation to make the changes, right? Because they're not going to be able to just take one magic supplement to fix it all.
I agree. And there is one thing as well, which was really interesting regarding the patient. So he's originally from Austria. So he went, like, I think 1 year ago, he went to his usual endocrinologist, diabetologist. So she told him, like, okay, let's reduce the drugs that you're using. He said, like, I'm not using any, like, for 3 years already. So that was really interesting. I mean, yeah, but you have to be disciplined. There's no way.
Well, and what's nice is as an MD, you can do that, right? A lot of us under our scope, we still have to, have them go back to their prescriber to make any adjustments. And a lot of them are not always, super open to that.
Do that, yeah.
Right? They just think there's no way they would not need this anymore. But then the blood work will show.
Yeah, 100%. I mean, what I usually advise them, okay, try to find another one. If I can't refer to something like regarding some drugs or something. I'll try, for example, if there's symptoms regarding like fibromyalgia or something, if they are going to refer to neurologists to give them, or MS, for example, multiple sclerosis. So you have to find another one who is open to work with you.
Yes.
We are not robots to just give us one thing and just follow us for 5 years or 10 years. Right. So I'm a human being or living organism, and my body is changing all the time. If it's in inflammatory state, some other things will be affected 100%. So it's just a matter of time.
Yes. Yep. And they're caught in that loop, right? Of just then more things become problematic as they get older, and
100%.
It's a bad cycle.
Yeah, usually people tell patients when they come, so we have to focus on prevention first right now for anything that could develop in certain amount of time. And then we should start working on the issues that you already have. But we have to go through history. Of course, to see where the root cause potentially could be and then do the testings. I mean, of course, it is sometimes expensive because you have to dig deeper.
Yes.
And unfortunately, any kind of insurance doesn't cover those stuff. So, I mean, I will give my best to decrease the cost as we can. But sometimes, I know for my own health, I spend thousands of dollars just to do testings and then find out where is the issue. And when I found out, I basically, every other dollar that I have, I kept it in my pocket. So I'm not spending it anymore and just doing like regular blood checkups and anything. Right. Because HbA1c is one part, or insulin is one part, C-peptide is one part. But where is the stuff that are leading to that?
Yep.
So we have to check it. And that's time consuming, especially when you wait for results. When you're in Europe and you're sending it to the US.
It's 3 weeks just for us. Yeah. So for you guys,
a week,
I'm sure
and
it's
2
much
more.
longer. Yeah.
So, but still, I tell them, okay, let's do the basics during this 1 month period that we are waiting for. Let's fix the food. Let's take some supplements that are being anti-inflammatory. Try to do some sort of activity like walking or something if you can. Let's fix the sleep routine, or to set up circadian rhythm, to fix the timing when you eat food as well. So those are the basics. And then when we get results, okay, we can go deeper in everything. So I can set up the therapy, I can follow you up even more and everything. And that's when we do that, we have results 100%. So there is, this was really interesting. Whenever we follow up patient totally, we got rid of the drugs. Whenever there was like just, okay, I'll do it on my own, I'll do that whole stuff, you don't have too much results because there are too many questions outside. For example, if we are talking here, okay, I don't know what's happening outside. Someone can tell me, but probably that will not be correct information as a whole. So if we are going to do some stuff, let's do it from scratch, and let's fix everything that we can.
Yes.
Let's work together, basically.
Yes, yeah. The foundations are always first, and then it's our job to dig and keep finding really the roots and really get to the more prevalent and problematic symptoms that they're dealing with.
Yeah, 100%. I mean, what else I've seen in practice is sauna. So when we use, for example, infrared one, so when patients use like 5 times a week, like 30 plus minutes, usually their blood sugar just started to decrease.
Yeah.
Just with that.
That's amazing.
Yeah, that was really, really good. At the beginning, it was started to go up after the sauna, but like after a few weeks, 2-3 weeks, that it started to slightly decrease. That was basically period when we were waiting for the results.
Right.
So, I mean, afterwards, you have different influences regarding supplements, therapies, food, and everything. So yeah, that was really as well eye-opening moment. And I mean, of course, you should discuss those stuff with your MD or people that are following you and treating you. So yeah, this is really good advice to implement.
Well, it's been amazing to have you on. Where can everybody find you?
Yeah, so you can find me on webpage. It's drnuhic.com. So this is our webpage. So as well, we have Instagram and Facebook social medias. So on Instagram, it's Omar Nuhic or Nuhic. So OMRAR. So NUHIC. So this is our Instagram and Facebook page.
Well, it was such a pleasure to have you on. I'm glad you're spreading this throughout Europe and in Bosnia.
Yeah, thank you very much for having me, and it was really nice to talk to you.
Yes.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks. Real talks from real doctors on the issues that matter to you most.